Hello, so all of you have a piece of paper in front of you, and if you could take a look at it and take a look at it right now and pretend that you are the head of a business and you want to hire a new office manager. So you have received many applications, this is just one of them, and you are reviewing this resume to see if you would hire this person named John Joyce. So I'm going to ask you a question and it's very important everyone responds. Would you hire John Joyce? If you would hire John Joyce, please raise your hand. Okay, and if you would like to hire someone else, please raise your hand. Okay, interesting. So the reason I'm here today is to talk to you about the anti-fat bias. And what the anti-fat bias is preconceived ideas of a person's personality and their characteristics based off a visual assessment of their weight, deeming that they are overweight. So what this means is that upon seeing someone, you will judge whether they are overweight or not, and then if they are overweight, you will have a set of negative, preconceived ideas in your head about this person simply off you looking at them. So what I just demonstrated for you all was the anti-fat bias. So I gave half the class, the front half of the class, this resume, and I give the back half of the class the exact same resume, but with a picture of John Joyce, and John Joyce is very obese. So I wanted to see if when people receive a photo of John Joyce, they are less likely to hire him than if they were just to receive his application. Now, your results were not exactly what I expected, but I can account for this by saying that maybe a lot of you wanted to not hire John Joyce, but you were too embarrassed to say you wouldn't hire him based off his weight, or you don't want to admit to yourself that I realistically wouldn't hire him based off it. I realistically wouldn't hire him, and it's because of his weight. So a study like this, well, many studies like this have been done, but one was recently done in 2011 called the Role of Automatic Obesity Stereotypes in Real Hiring Discrimination. And basically what this study, the results of this study showed that obese and overweight people are far less likely to get hired than their average weight counterparts, even if they are more qualified for the job. Furthermore, if their job they're applying for has lots of interaction with people, they're even less likely to be hired because the people who are doing the hiring don't want them to be seen. So, for example, if you're applying for like a telemarketer job and you're just going to be on the phone, not actually coming into visual contact with the customer, you are a little bit more likely to get hired, but still less likely for that position to get hired than someone would be of average weight. So even though the weight you have does not affect your job at all, you will still be less likely to get hired. So you may be wondering why I'm presenting to you about the anti-fat bias to Impulse Certified Nursing students, and it's because you all are going to come into contact with obese and overweight people on almost a daily basis in any job setting you have. You will be caring for people, doing things such as taking them to the bathroom, toileting, bathing, grooming, and helping them eat. So these are tasks that people can't perform by themselves, and that's where you're helping them. The people cannot perform these tasks often because of reasons of limited mobility or immobility. So what this means is that that factor combined with other factors such as drug side effects, health concerns, and lack of exercise will leave your patients often obese or overweight. So this is just something you're going to have to deal with and you're going to have to get over because you need to provide obese and overweight patients with the exact same adequate care you would with any other patient. So it's important to understand the anti-fat bias and to try to prevent yourself from perpetuating the stereotype of fat people being associated with negativity. You need to understand what explicit and implicit prejudice are. So explicit prejudice is where you have preconceived ideas of someone and you realize you have them. So you are aware that you think obese people tend to be more lazy, less intelligent. You are aware that you have these feelings towards them. So if you were in the back of the room and you got the resume of John Joyce and you saw his picture and you were like, I would never hire this guy, then you know you have explicit prejudice. Well, implicit prejudice is often preconceived ideas that you are unaware you have. They might be in your that you might have them unconsciously, subconsciously, or you can act in a way which you're not even sure you're acting, and implicit prejudice is hard or impossible to control. So for example, an example of implicit prejudice would be if I was to open the door for all the average weight people, but I never opened the door for anyone who is obese or overweight, even though I might think, oh, I'm not biased towards overweight people, clearly I am showing biased behavior in me aiding people who are average weight, but not people who are overweight. I don't admit that I have this discrimination, and I don't think I do, but I obviously am observing discriminatory behavior. So what's really important in trying to control the anti-fat bias is being aware of your initial reactions towards someone. So kind of like your snap judgment of someone. So if you were to receive a patient's chart with their information, or if you were to walk into a room and you see a patient, and the first thing you see or the first thing you read is that they are overweight, maybe your initial reaction is, great, I don't want to do this, they're going to be more work, they're going to be a harder patient, they're going to need more care from me, something like this. Now, it's important that we realize what our initial reaction is, because if we realize what our initial reaction is, we can then go on to try to change our behavior and edit it in a way which is non-discriminatory. So I'm going to show you two sets of photos, and for each set of photo, I want you to observe and compare your initial reactions to these photos. So here's the first set of photos, and in this set of photos, there is people of average weight who are going for a walk or exercising, eating, just doing very normal activities everyone does. Okay, so most kind of initial reactions to this would be maybe minimal reactions. You don't have a lot to think, or you think, oh, that person's attractive, or oh, that looks good, or oh, I'm like them. Like, you put them on the same level as you. You are the same. Now, if we look at the next set of photos I have, if we see here that this is a collection of photos of obese people, and many initial reactions to these photos are things like, oh, gross, cover that up, ew, that's disgusting, I don't want to look at that. And I think this is really interesting because these people are doing the exact same activities as we saw in the previous slide. They're going for a walk, they're eating, yet somehow the same activities, different people doing them, can receive the reaction of stop doing that, that's gross. Or just being you, just going for a walk is grossing me out. I don't want to look at that. It was interesting, like even as I'm looking for Google to put images on the PowerPoint, it's hard to find an image of an obese person who isn't making fun of themselves, someone else isn't making fun of them, they have it edited in some way that makes fun of the person, or the obese person isn't eating. I mean, in like all of these photos, the obese people were all like posing with a burger, haha, or like shoving food in their face, and it just is like perpetuating the stereotype that if you eat, you're all of a sudden obese, when in reality, many people are obese for reasons that have nothing to do with the amount they eat. So as we can see that there is a very large anti-fat bias in all of common society, especially, and it's interesting because in the United States today, almost 35% of adults are considered obese, and yet we still associate all those people having all these negative characteristics. But if we think logically, no, this 35% of adults do not all have the same characteristics based off their weight. They're probably entirely different people, each one of them. But we give this stereotype to all of them and then treat them based off the stereotype. So if you observe your initial reactions, you can try to change your behavior. You can observe, hey, I think this about overweight people, and even though I think this, I'm not going to act upon it. Even though I think this person is lazy and going to be hard to help, I'm not going to treat my patient like that because I don't know that they could be a joy, and I'm going to have my behavior not reflect how my stereotype and my unfair bias against these people, because at the end of the day, you don't know these people and you can't treat them based off a bias you have in your head. To be a good CNA, you have to provide everyone with adequate care, so you cannot let a bias stand in your way. And when you get to your job sites and you're working with other CNAs, it's also important that you observe their behavior, because maybe they're implicitly they have an anti-fat bias they're not even aware of, and they're unconsciously treating their overweight patients differently than they're treating their average weight patients. So by observing, just by being very observant of your actions and the actions of other people, you can attempt to not act in a way which is discriminatory and perpetuating the stereotype against overweight people. This is especially important for CNAs, as I've already talked about, but a lot of you might feel like, oh, I don't have a bias within me, I'm not biased. But this just simply isn't true. There's been many studies done. One of them was in 2001 called the Implicit Anti-Fat Bias Among Health Professionals, Is Anyone Immune? And the results of this study showed that even healthcare professionals in all fields of healthcare show some degree of the anti-fat bias. And this worries the general public because if they think, oh, if you can't control your bias, how am I supposed to control my bias? But as I explained, the key is to be aware that you have a bias and to just be very observant of your actions and your initial reactions. So if you follow these steps, I have no doubt in my mind that you can overcome the anti-fat bias and be a very good CNA to all your clients.